and welcome to this podcast for the University of Alabama at Birmingham's CounterACT Research Center of Excellence in Arsenicals. My name is Mina Nabavi, and I'm a program manager in the UAB School of Public Health. Today on the podcast, we are joined by Dr. Ziad Kazzi, professor of emergency medicine at Emory University and consultant with the UAB CounterACT Center. Dr. Kazzi has been a guest on this podcast many times, and we are happy to have him back on the podcast. On August 4th, 2020, a devastating explosion occurred in the port of Lebanon's capital city, Beirut. The explosion left over 200 people dead, over 8,000 injured, and over 300,000 people were displaced from their homes. The explosion destroyed and damaged health facilities in Beirut. Dr. Ziad Kazzi joins us for this podcast to answer questions about the explosion around the one-year anniversary of the Beirut port explosion. So thank you so much, Dr. Kazzi, for being here and taking time out of your schedule to talk with me.
Thank you, Mina, for having me.
So Dr. Kazzi, to get us started, I know you were in Lebanon at the time of this blast. Can you tell our listeners where you were located? Can you talk about your firsthand experience?
Absolutely. Thank you, Mina. You're correct. I was spending a month in Lebanon in August 2020, July-August 2020. As you know, and maybe our listeners do not know that, I'm actually of Lebanese origin. And I grew up in Lebanon, so I travel there every year. I'm actually an adjunct professor at the American University of Beirut Medical Center and School of Medicine. So my trips to Lebanon are regular. And during that period, I was staying away from Beirut in the mountain. As you know, this was during the COVID-19 pandemic peak that was starting in Lebanon in around May 2020. Lebanon had weathered the pandemic initially, but then we started seeing an increasing number of cases starting May, June 2020 approximately. So that day, August 4th, 2020, I did visit Beirut. I did drive down to Beirut with my family, where we have a home that is located 2.7 miles away from the Beirut port. At the time of the explosion, I was supposed to be even closer to the port, 1.2 miles away at a meeting venue. However, fortunately for me, my sister who was picking me up was running late, and I was still at my Beirut home, 2.7 miles away, after 6 p.m. when the explosion occurred. The events that led to the explosion also were unknown to me at the time. Reportedly, there was a fire at the port that was in hangar 12, number 12, where the explosion occurred. The firefighters had arrived at the scene to try to control or extinguish the fire. And at about 6:08 p.m. local time, the explosion occurred that rocked my apartment 2.7 miles away. We had broken windows. We had blown out store doors on the street level. And it was a shock that still haunts me until today.
So can you talk about what happened? So, initially there was a fire. What exactly happened in the blast? What caused the blast, and what chemicals were involved in the blast?
Certainly. I do have to say that the information, so this whole disaster is still under an active confidential, secret investigation by the Lebanese judiciary and Lebanese government. So what I'm reporting to you here is based on what is in the open source, and on the media. So certainly we all know by now that this was an ammonium nitrate explosion. Ammonium nitrate that was stored in 2014 in hangar 12 in the Beirut port. The amount that was reported as stored is around 2,750 tons. Now, the amount that exploded on August 4th is not finally determined. There are reports that the amount was actually less, was about maybe 500 tons of ammonium nitrate, still a devastating amount. There are also reports of additional chemicals in that hangar 12, including fireworks, ammonium phosphate, and detonating cords, as well as other items like tires, tea, and coffee. but those are, of course, unconfirmed reports. These chemicals, specifically the ammonium nitrate, as time goes by, it can degrade. I'm not a chemist or an explosive expert by any means, but what I've read is that the storage conditions of ammonium nitrate should be considered here, because as time goes by and the storage conditions and the deterioration or degradation of the ammonium nitrate can lead to it becoming more dangerous. Also, the presence of another source for the fire, which is, the welding induced. Well, there was reportedly maybe a welding of a door that led to a fire. That fire itself is a source of ignition that can also, cause the ammonium nitrate to detonate. Ammonium nitrate per se is not going to detonate easily. This is why the importance of keeping any potential sources of ignition away from it. Typically, my understanding is when you store ammonium nitrate, you have to keep it away from other potential sources of ignition. You should have physical barriers, you should have fire extinguishers, you should have any potential mitigation strategies to avoid it from catching fire, because that will lead to its detonation. So certainly, this is the current theory about what happened. Of course, there were other theories that were being promulgated on social media. Was this a detonation due to a bombing of some sort? Was this some other? Were there some other chemicals stored there? That honestly is unknown to me and certainly unconfirmed currently as of today.
Can you talk a bit about the implications of the chemical exposure to ammonium nitrate?
Well, ammonium nitrate in this situation detonated, and the primary exposure here was non-chemical. The primary exposure was that of a blast wave leading to destruction. So the blast wave that was released from the ammonium nitrate detonation was a very powerful and rapidly spreading shock wave of pressure in the surrounding area. This is probably a supersonic speed wave that will lead to some of the clinical manifestations of blast injuries, specifically your primary blast injuries. So again, trauma is going to be your major mechanism here. Of course, there were also secondary impacts that we will talk about later on, as well as public health impacts. But the primary issue here is the detonation of this explosive material, this primary blast wave that's spreading in the environment, also taken with it fragments from the surrounding structures that in themselves can cause injuries, penetrating injuries to the victims that are in the area, as well as tertiary blast injuries, which were due to more the collapse of structures and other types of trauma that the victims will sustain by being thrown back or falling down, or having other types of traumatic injuries. All of that is compounded by the quaternary blast injuries that you can expect from a scenario like this. Quaternary blast injuries are basically everything else, from burns to inhalation of smoke, inhalation of toxins that are in the environment, toxicants, dust, as well as the other exacerbations of comorbid conditions, and of course, not to forget mental health. Mental health impacts of these type of disasters are very severe, as we are learning from some of the research that is being conducted right now on the affected populations.
That leads in nice to the next question that I want to ask about kind of the impact of the explosion on the city and on the people in general. Can you talk about that?
One of the things to remember is always to think about where the explosion occurred. If you think about the environment, if you think about the host community of this disaster, and if you think about the agent. Now, when you think about the agent, I think we already covered this. This is a high order explosive that will detonate and have a primary blast wave that will cause its own primary blast injuries. And we can talk about those in a little bit, but that's the agent. And of course, the amount is large as well. When you think about 500 tons or 2,750 tons, these are unprecedented explosion levels. So that's something to consider. The other thing to consider is the environment. Now, this was an open environment. The explosion occurred in the port. The port, luckily, during COVID-19 at 6 p.m. in the summer, was probably less busy. The activities were probably less in intensity, and the number of people at the port was probably lower. Of course, we had our hero firefighters that were on the scene that died from this explosion, as martyrs. Also, add to that the surrounding area. You had basically tall, newly built buildings with glass facades, which immediately makes you think that you will probably get a lot of glass fragments injuring the victims. You also had businesses, so people were at their shops still around 6 p.m. in the summer, as well as residents that were either coming back home from work or living there. This community also includes people that are there for decades, older people that live in older homes in the surrounding neighborhoods. Those are also vulnerable because their socioeconomic status may be different than some of these more affluent residential areas. These are individuals that are also older and have less physiologic resilience to injury, and may also have children that are abroad, immigrants, so they may be alone with little social support. So when you combine the agent, the host, and the environment, you can expect a wide perimeter of injuries and damage. You can also expect significant, socioeconomic consequences affecting the victims in that scenario.
And I would just like to point in for anyone who would like to learn more or listen more, you did record a webinar for our center and included some images of Beirut, and I found that very helpful. So if any listeners are interested, I would encourage them to listen to the full webinar, and they could see some of the images and videos actually that you included in your talk.
Certainly, I think shedding light or raising awareness about this horrific disaster is very important. This is not something that's done or completed. The impacts are still active until today. Lebanon, is going through an unprecedented historic economic crisis, compounded by COVID-19 and a political crisis, and then this disaster. I think we need to better understand the impact of this disaster on mental health, on the aerodigestive system, on other body systems of the survivors and the responders who were vigorously rescuing people potentially physically injured, as well as exposed to chemicals that are released in the explosion, if not necessarily from the primary explosive, also from the surrounding structures, the debris, the dust that people have inhaled. All of these are known to cause real health effects that need to be monitored. And I think we need the help of the international community to be able to support research and public health efforts to further mitigate this disaster and help the community to recover over the next years to come.
One of my last questions was about long-term impacts, and you touched on that. We're only a year out. Do you see any long-term impacts from this blast?
We already see impacts that are unfortunately potentially long-term. There are some initial research studies that are being published right now. Some are not published yet, looking at mental health consequences. It's really hard to separate mental health disease today as primarily caused by the Beirut port explosion, because as you know, there are other stressors currently affecting the Lebanese population. But certainly, some of these mental health effects are directly related to these experiences, these traumatic experiences. The risk of cancer, the excess risk of cancer that people may be subjected to after the exposure to chemicals and dust and debris. This will be certainly something that needs a longer follow-up period. Of course, there will be also a latency period before you start seeing some of these effects. That needs to be studied. It's not too late to study that, but we need to start today preparing for this. Cardiovascular conditions, endocrine consequences, aerodigestive consequences, respiratory system consequences. should be researched and studied, not only for the research perspective. I mean, that's the benefit that the rest of the world will get, is advancing the knowledge about these disasters, but also to care better for the affected population and to mitigate some of these health effects. I think this is an unprecedented explosion. It's happened before, unfortunately, and it may happen again. We need to learn from it. We need to really remember to always question the safety of our chemicals, the security of our chemicals in our communities, as well as rise to this occasion or opportunity and try to learn as much as we can from this disaster. I think this is one way to honor all the lost people and honor the families of the victims who died in this or were injured in this horrific tragedy.
Thank you, Dr. Kazzi. I know we're wrapping up. Our time is coming to a close. Is there anything else that you would like to share with our listeners before we wrap up?
I want to thank you for listening to this podcast. I hope you will spread this message amongst your community of researchers, academicians, or even family and friends to keep the Lebanese population in your mind and offer them support when you can. And if anyone wants to follow up, I'd be happy to receive any email or Twitter messages on my Twitter account at Ziad Kazzi.
Thank you, Dr. Kazzi. We'll be sure to put your Twitter handle in the description of this podcast. And I would also like to link to the actual webinar that you did for us. So if our listeners are interested, they can easily access that. So thank you to our listeners. Please tune in next time for another episode from the UAB CounterACT Research Center of Excellence in Arsenicals.